So, Mr. Hill, who referred you over?
My dentist. We went to school together. Charlie Hudson's.
Oh, Dr. Hutchins? Okay.
In Chiaffi.
Oh, you saw Chiaffi? Did Chiaffi do a biopsy?
No. Charlie's my dentist. Who did the biopsy? Shands.
The biopsy was done at, it was ordered from the ENT, Dr. Herrera. And
okay.
it was done at St. Vincent's Clay.
Okay. Did you get the results of the biopsy already?
You should have all that here already.
And what did it
And
show?
Herrera said we had a stage 3 and 1 lymph node.
Okay. Okay.
And then there's HPV
Squamous cell.
on the tongue, in the back of the throat. Positive though.
On the back of the tongue where you can't see it.
Right, HPV positive.
Yeah.
Yes.
Okay. What symptoms are you having? Any difficulty
Can't swallow,
swallowing?
yeah.
Okay. Does your ear hurt?
No, I'm having headaches.
Headaches? Okay.
I don't know if it's from that or not. Yes, but
Okay.
25, 30 pounds.
I have you. Okay.
From 210 to 180, 177.
Okay.
177 and a half this morning.
How's your appetite?
Not good.
Okay.
I can. You have to chew your food more. When you chew your food more, you don't eat as much.
Of course, I understand. Yeah.
Your mom said, chew your food, chew your food.
Yeah, at least 20 times.
Yeah. By the time you do that, you lose your appetite.
Okay. Are you healthy otherwise, Mr. Hill?
Yeah, I teach line dance 4,
Really?
5, 6 times a week. Yeah.
Okay.
Dancing, so I'm very active except for this sleeping.
None of the common things: high blood pressure, diabetes, asthma.
No, I had 2 new knees. I wore them out dancing.
Okay. All right. Well, that's a good way to wear them out. That's fantastic.
When were those?
99.
99.
Okay. Okay. Do you smoke, or have you ever?
When I was 9 years old,
That's it.
I quit.
Okay.
My daddy taught me.
All right. That's a good way to quit. Any alcohol use?
It's some.
Okay. How many drinks in a day usually?
This evening I drink some red wine.
Okay. All right. Are you allergic to any medications?
Mm-hmm.
Okay. And aside from the knee surgery, have you had any other procedures done?
Just tonsils.
Tonsillectomy.
Tonsillectomy.
47.
47. Yeah.
Okay. All right. Well, let's take a look.
Sorry, any meds that you're on?
No.
Okay.
Thank you. This thing's Sorry. Yeah, I'll feel that too, if you don't mind. Just look straight ahead and open your mouth. That's good. I'm just gonna look everywhere first, okay? It's okay. I'm just gonna feel for a minute. Try to relax.
I brought all the paperwork over before with the results of the biopsy and all that kind of stuff.
Yeah, Tasha's got him in her office.
Yeah.
Most likely Tasha has it.
That looks great. Okay.
So she'll communicate that on to us.
Let me just feel for a second. So you noticed the lymph node pop up, or that was found by? Okay.
No, we noticed it.
When it first popped up, he said this is your carotid artery sticking out because of weight loss. So we lost 2 weeks because of that.
It's okay.
How long was the span of losing the weight? Of 30 pounds?
November to now.
No, December really, because November at Thanksgiving is when we really started noticing he just really could not eat.
Okay.
Had a sore throat, could not swallow. I mean, we have a huge family, and I just kept watching him. I'm like, are you not hungry, or are you going somewhere else to eat, or whatever? You know, you've been cooking for 2 days, and he's not eating. And I'm like, what's wrong? He said, I can't.
Okay.
And then the next thing I noticed, we had an MRI of the brain done and a CAT scan done and everything, because with the slurred speech and the not swallowing and the weight loss, I thought possibly he might have had a little mini stroke or a TIA. I took care of my mom and my dad until they both passed away, so I kind of went through all these different stages, you know, and I thought, well, gosh, you know, and my dad came back from several strokes, I mean, almost 100%, but he wears a rubber guard in his mouth at night so he won't grind his teeth and snore, and I kept thinking he had the stupid thing in there because I couldn't understand him. And then finally he said, that's what I'm trying to tell you. I can't, it's really hard for me to get my words out.
Okay.
So they were saying that
there's
lymph
like
node
a- I
may be pressing on that one side of the tongue.
Yeah.
Well,
Well,
it's
I can't move.
broken
I can't move my
down.
tongue like you. I can't get the roof of my
It's
mouth.
more likely.
Yeah.
It's more likely just that the tumor causes some fixation.
Yeah, okay.
And whatever's on the back of your
Yeah.
tongue.
So we need to do a couple things today. We need to take a look at that recent PET scan.
Right.
Okay, get a little information, and I think we'll introduce you to Dr. Fernandez. We'll get a look down your nose with the fiber optic scope, just to visualize the back of the tongue. But I can feel it quite easily, so it's very obvious that it's a left tongue base. We call the base of tongue rather than the oral tongue.
Right.
And you have the node there. The good news is that you do have the HPV positive squamous cell. So while they're quicker, that type is quicker to go to the lymph nodes and travel, which is a risk factor. The good thing about it is that it's much more responsive to radiotherapy, right? And even if it wasn't HPV positive, the tongue base is a place where the primary line of treatment is radiotherapy, radiation. So your timing is pristine, because today is our multidisciplinary head and neck tumor board. So we're going to meet with the radiation oncologist today.
Great.
We'll discuss your case, present all your imaging results, and get one of them on board, either Drs. Dagon or Curtis. Both very bright guys. They have a wonderful institution that I think you'll really like. And they will be the ones who you primarily have interaction with in the coming weeks. But we can get the ball rolling immediately today, okay?
Okay, well, here's one thing we want to tell you. We've seen a Dr. Dwelvin Simmons.
Oh, okay, yeah.
And I think he worked under Dr. Fernandez for like 5 years, or he was
They may have
teaching.
trained together.
That's what I mean,
Okay.
or something.
Hey, all done?
But
Okay.
we really came here for a second opinion,
Oh, okay.
But if he can get better care here, we're driving from Middleburg.
Orange Park, Middleburg.
Yeah.
Okay.
So, and they told us this would probably be 5 days a week, for 6 to 8 weeks.
Yeah.
And if there's something better that, can be offered here.
Well, obviously we're always a little biased,
I know. But then there's proton therapy versus photon. Am I saying this correctly?
Yeah, electron. Yeah.
Electron, okay. And he's just saying that what y'all have is a little more superior to it. Dr. Dwelvin Simmons is saying that what you have here is a little bit more superior to what he has equipment-wise, because y'all have it where it'll go straight to that one little...
Yeah, I'll talk to them about, I don't know if they'd recommend proton therapy in this case, but what they do have, they have very sophisticated IMRT or treatment planning protocols, so they can use 3D-dimensionalize your scan and focus the beams very specifically to the area that needs targeting, so that you have less scatter, because radiation. And Dr.
We all had signs something. Your spine's gonna be ruined. Your eyes are gonna go away. Your teeth gonna fall out.
It can ruin a lot of things, and so that's why the better you can focus the therapy, it's every incremental.
That's why my dentist wanted me to come here.
Yeah.
To get.
Yeah. Okay.
Your opinion, and maybe he thought surgery was the first thing rather than.
Yeah.
That's what.
Unlikely. We'll talk about it and discuss with the radiation oncologist, but I think the protocol would be for radiotherapy given the location of that tumor.
And that's what we've been told, but because he and Charlie have been friends their whole life, they graduated high school together and all, they just said, this guy is supposed to be the guru of neck and throat, and go over there and let him look at it and just see if he agrees with what you've been told so far.
Well, I'll introduce you to him. We can get the scope and take a look directly at the tumor, see if there's, I think probably, I'm guessing what we'll find is that it's what we call submucosal, meaning it's underneath and you can't see a lot, but we can look nonetheless, right?
Now you're practicing like the other.
I'm the fellow, so I'm the fellow. I'm the head and neck fellow, meaning not much to you. It means I'm the peon. Everybody's my boss. So I just
one day you'll be the boss, but right now, new guy.
But let me introduce
you're from the University of Florida.
Oh yeah, all of us work for UF. Yeah, everybody here.
All right.
Hang tight.
All right.
It's a pleasure to meet you. I'll be back with the boss. Okay.
All right. Same here.
Don't let him fool you. He's high up. In 2 months he'll be the big boss of everyone. So.